Hi, my name is Cody Peterson, and I'm the head athletic trainer at UW-Milwaukee. I'm going to be teaching my student trainers here today how to tape an ankle and how to tape a wrist. Derek here hurt his ankle at practice. So first we want to make sure it's not broken, see how swollen it is. And I see it's a little swollen right here. And if it doesn't look like it's broken, you want to just tape it right away or ice it. And right away we're going to ice it. So we're going to apply this. If you have a bag, just put it on there. If you have frozen gel, you want to put something between the skin and the ice so it does not give the skin frostbite. So you want to make sure this is nice and snug. You want to go from corner to corner. You want to make sure it's not too tight though. Is that too tight or is it loose?
It's good.
It's good? Alright. So when you have your athlete's ice, you want to make sure the bag does not have too much air in it, so often you're going to have to poke a hole. Then you want your athletes to ice from 10 to 15 minutes. Make sure it does not freeze the spot that you're trying to ice, and then rest it afterwards. So then we'll take this off to move to the next step. Now we're going to tape the ankle. Say he's going to practice, you're going to do this before the practice or a sporting event. First, you want to either shave the spot so the tape does not stick to the leg, but here it's a one-time deal, so we're just going to use pre-wrap and stick so he does not get the hairs from his leg torn off. First, you want to put a lace pad here so he does not get a blister, and also a heel pad. And then you're going to use pre-wrap so you do not directly apply the tape to the skin. You want to make sure you cover the whole foot itself along with the ankle. Once you get the pre-wrap on, you want to put 3 anchors at the top of the ankle to secure the base. It's 1 anchor. Next, you want to put 2 stirrups from the bottom of the foot along the side. Sometimes you're going to have to do it over if the tape is not tearing. And this secures the ankle and puts in place for the rest of the tape. Then you want to put anchors at the bottom of the foot. And then you want to continue to put bands around the rest of the ankle. Once you finish your bands, you want to do a couple of heel locks to keep the heel in place. And you want to finish with a couple of figure eights, where you go from the top of the foot to the back of the ankle and to the bottom of the foot. And that's how you tape an ankle. And now, also, you want to have your athletes take ibuprofen to lower the swelling, and also have them rest it, and if possible, use crutches. Now we're going to tape his wrist. If he's a baseball player, they could hurt the wrist hitting, and sometimes even throwing. So this is a common injury that we'll go over. Same idea with an ankle. You want to get your base with the pre-wrap and secure the thumb. Use an anchor. And then next you want to set the thumb in place. You want to make sure it's not too tight so they keep their range of motion in their hand and it does not swell up on them. And when you're doing this, you want to communicate with your athlete, make sure it's not too tight and they keep their motion and feeling in their hand. Because if you do it too tight, then it can cut off the circulation, which can even make the injury worse. Same with the ankle, keep ibuprofen or ice, and the swelling will go down and rest, and they'll be back playing in no time. And that's all we have today.